Oke, assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Rifki Alfiadi Amalia Putra. I'm from University of Jember, Faculty Public Health 2021. In here, I will to explain a little about hemorrhoids. Definition of hemorrhoids. Hemorrhoids, also known as hemorrhoids, are enlargement or swellings that occur in the rectum of the rectum. Hemorrhoids are a health problem that can affect anyone, but they are more common in people aged 50 and over years old. Hemorrhoids are divided into two types, namely internal and external. Swelling of the veins that occur inside the rectum and can be seen from the outside is called hemorrhoids. Meanwhile, swelling that occurs near the anus is visible from the outside and painful is called external hemorrhoids. For the next is symptoms of hemorrhoids. For the first, lumps that appear outside the anus are typical symptoms of hemorrhoids. Other symptoms that often occur include, and the second, experiencing irritation or itching, pain, red swelling around the anus. And the third, a lump appears that is located like hanging on the outside of the anus and feels sensitive and painful to the touch. Usually, the lump will go back into the rectum after a bowel movement. And the fourth, bleeding occurs after defecation without pain. And the last, exit mucus after defecation. And the next, how to prevent hemorrhoids. For the first, drink a lot of water. This can help soften the stool. You don't have to strain too much. This is because the habit of straining during bowel movement can use hemorrhoids. And the second, increase fiber consumption. Eating a lot of vegetable, fruit, whole grains, and nuts can help smooth bowel movement. And the third, avoid delaying bowel movement. The longer the feces are not expelled, the more water is absorbed by the intestines. As a result, the stool becomes harder and drier. This forces you to push hard during bowel movements and result in hemorrhoids. And the third, exercise regularly. This can help prevent constipation, help lower blood pressure, and aid weight loss. For the fourth, avoid certain medication. Avoid drugs that have the side effect of consumption. For explain, drugs that contain codeine. And the fifth, avoid sitting too long. This habit can increase the pressure on the veins in the anus. And the last, keep the anal area clean and dry, especially after, during, and defecating. Okay, and the last material of this presentation is how to treat and prevent hemorrhoids. Hemorrhoids must be treated immediately so that they do not swell and burst. Or twice. Treatment can be by, for the first, implement a healthy diet, and the second, taking drug or using hemorrhoid ointment, and the last, undergo hemorrhoid removal surgery. This is the end of my presentation. For more or less, I'm so sorry. Don't forget to like, comment, and subscribe in this channel, and see you in the next video.